Good morning. This is Sierra. Hi, with the Health Professional Loan Repayment Program. Thanks for joining our webinar. Okay, so our agenda. So I want to introduce myself, Sierra. Hi, I'm fairly new. I've been here with the program for almost a year now. We have also with us Chris Wilkins, and she's the program manager. I know most of you who are familiar with the program and have completed this application in the past are familiar with Chris. And then we have Jaylee Schultz, who is our new Associate Director of our Workforce Program. So this is her kind of first exposure to this as well. We will go through a program overview, kind of a high-level overview of the two programs. I know there's probably some newer people who have never completed this application before, so I want to make sure we're kind of going over the basic requirements. We will go through the site application step by step, and then Chris is going to be monitoring the chat box and the question box for any questions that are coming in that she might respond to, or if there's kind of a natural pause or a question that's really relevant to the screen we're on, we'll take some time to answer those questions as we go. And then hopefully at the end we will have some time for some additional questions. And I will say, just for the interest of time, if we could keep questions kind of specific to the site application process. If you have questions regarding your site's eligibility, oh my goodness, you know what I'm saying, then I would just ask that you contact us directly or go through our guidance so that we can kind of spend more time one-on-one with you to kind of review some of those more detailed questions about your eligibility. So we have two programs. We have our federal state loan repayment program and then our state-only loan repayment program. So there's some different funding sources and different requirements with these two programs. Our federal program, you are required to have a HPSA designation. You should be a nonprofit, and you should have a posted, implemented sliding fee schedule. The state, these requirements are optional. For both programs, sites must be in business for longer than 1 year, and this is so that you can provide a year's worth of patient data. All patients, you must see all patients regardless of their ability to pay and must accept Medicare and Medicaid. You must provide comprehensive outpatient primary health care services. And this goes into greater detail in our guides that will, I'll show you the link to those a bit later on in the slides. That kind of gets more into discipline specific, and you can see the mental health services. In order to meet that comprehensive primary health care services, you have to be doing this in an integrated setting, and there's some more requirements on what those services should be. And if you don't offer those services, you should be having agreements or be integrated in your setting with primary care. So we have different provider license types that are eligible for the programs. For federal and state, we have MDs and DOs, psychiatrists, physician assistants, nurse practitioners, registered nurses, pharmacists, registered dental hygienists, and certified nurse midwives, and dentists. Those are the license types that are eligible for both programs. And then our state is actually more inclusive. It covers a bit more. So we have naturopathic doctors that are eligible for this, licensed practical nurses, licensed midwives, and then our 4 new behavioral health license types: licensed clinical psychologist, licensed independent clinical social worker, licensed marriage and family therapist, and then a licensed mental health counselor. And I will say that these have to be the independent licensure. The associate level is actually not an eligible license type. So the service requirements for the two programs are also slightly different. So for the federal, it's a minimum 2-year service obligation. You have to work a full-time, which is minimum 40-hour work week, and the max award is $70,000. For HelpWork, it's a minimum 3-year service obligation. It's a little bit flexible on your work schedule. It's 24-hour minimum work week, and then your service obligation is extended to that 3-year equivalency. The maximum award amount for the state-only program is $75,000. So this is kind of a quick overview of the process. It's a 2-step process. First, site supply, and they request their license types during the site application cycle, which is currently now open, and that's the application we're going to go through today. And then in January, the providers will then apply. So we try to, it's set to close, the provider application is set to close in February, and then we'll begin notifying providers of their award status in June. And the new contract for this application cycle for providers is going to start July 1st, 2018. And I will say too that this is the same application process for both of those programs that we covered. Okay, so getting into the site application, this is the URL of our website up at the top. So if you go here and you scroll to the bottom, you'll see our announcement that the site application is now open. We've extended the application closing date to December 8th. It was originally set November 30th. So you can click on this link, and that will take you to our portal landing page here. So if you've already registered and you already have your login, you can go ahead and just log in here. If you've forgot your password, you can click on that link and follow those instructions. If you have never registered before, you'll have to register yourself to set up an account. So you click on that register button to create your account. So you enter your first and last name and you go through these steps. It'll send you a confirmation email that you then have to follow that link in order to complete your registration. So once you're logged in, you'll go to our programs menu and then click down to the health. And that'll bring you to this page here. It'll show you these 3 options. These links will actually not be live, but this is the link that you should be clicking on for the loan repayment site. So you click on that. So this is the first page of the site application. Here are the links to our guides that I had mentioned before that have the detailed requirements for each program. This includes the site and the provider. So this is actually, these links will be, I'm going to switch back here. It's just probably going to be slightly slower. Go back here there. So up here is where you'll see those links. And you'll find these links throughout each tab of the application too, so for quick reference. This is where you would select your site. If you've had a previous site application, you should find it in the drop-down menu. If you do not see your site listed or you've never applied before, you'll have to contact program staff and so that we can get you entered in with your site name so that it appears in the drop-down menu. And I want to point it out that there's only 1 site owner per application. So just keep that in mind while you're completing this if you have to work with other program staff to complete your applications. So once you select your site here, if you've had a previous application, it will fill this information in for you. You have to verify before you move on from this page that you have read the guides and that you understand the guidance for both programs. And then we want you to verify this address here. So make sure you're verifying the accuracy of your site name, how it's spelled up here, and then also your physical address. And you can make any changes you need to through this edit functionality. And also, if you have a mailing address, we make sure to put that in if it's different than your business address. We do use this to send correspondence. So an example would be like the MOA agreement that you would be getting if a provider was awarded at your site. So just make sure that if you don't want your business address used as your mailing address, then make sure to enter that in there. And then you're going to select the county of your site, and this will be a drop-down of all the counties that you can select. And then you will want to do the census tract code. So this here, and I had originally had this linked in here, but when I tested this morning, it wasn't working. So let me have it pulled up here. So when you click on that link, it brings up this map for you. Oh, this mouse. All right, there we go. So just for an example, so you'll pull this up. I'm just going to put in our address here. So it'll pull up this information. And this here, sorry, bear with me, guys. Let's try this highlight. The tract code is what we're looking for right here. So you can just copy and paste that into the site application. I will say we found when we were testing, so if you copy and paste that, and then you go back to this here and you paste it, it automatically will put it kind of in the middle of this box, and it won't let you move forward. And that's because it's formatted to be a specific census tract code in a specific format. So just make sure that that is formatted correctly. And I believe we have a question here. All right, so can you help me understand why the census tract code is required and how that data is used? Yes, so this is important information that we gather to determine the health disparity of your area and your geographic location. So we get some information from the Department of Health that they keep track of as far as some health measurements of the area, and we use that as a factor in the score. Great question. Okay, let me make sure I'm following along here with my notes. One thing I do want to point out that's really important is once you started this site application, you should not be using the back and forward browser of your web browser. You should only be using the next and the previous buttons as they appear here, or you can navigate through these tabs up here. But please don't use the back browser when you're going forward. So once you have that information entered, you should hit next. And this is some eligibility criteria. And again, oh, my mouse is just a little delayed here. The links are up above here for you if you have any questions about what this might mean and if your site really follows these definitions. But you just check each criteria that applies to your site. So some of these things might not apply on this top-hand side, which is fine. This is just specific criteria for either the federal program and then, oh, there we go. Sorry, it keeps getting stuck. So if your site is a nonprofit or public-private entity, if you are a private practice and you confirm that you're serving the minimum required 40% underserved patients, and that is something that we do collect on the next tab. And we try to make this, if someone isn't eligible, it stops them from applying. So there is some logic built in here. So if you are unable to move forward, it may be that you are not meeting a eligibility requirement. So either refer back to the guides or contact us to kind of figure out what might be missing there. So if your site is located in a HIPSA, which is the federal for the federal program, is a requirement. So you would select that box. Here, let me. Nope. Okay, sorry guys. So you click that link, and this is what it'll take you to an external site, and this is what will pop up. So this is what you, again, you'd put in your address and look for the your HIPSA ID. I will say that the status will say proposed for withdrawal. HRSA is in the middle of updating everyone's HIPSAs, so don't be alarmed if yours says proposed for withdrawal. Go ahead and use that ID as it's presented after you put in your address. And sites, it says up here too, if you have a facility HIPSA, so those are the sites that are federally qualified health centers or community health centers that have auto HIPSAs, facility HIPSAs, then you would follow this link in order to get that information for your HIPSA ID. So you have that information. So we've gotten our HIPSA ID and we've entered it in here. And then there's some additional certifications down below that we've kind of went over in the beginning as far as some basic program requirements. So you have to have a non-discrimination policy and notice that no one will be denied access to services due to inability to pay, and that your site accepts Medicare, Medicaid, and CHIP patients as appropriate. That the site has been open for at least 1 year, and the site charges for professional services. There are some exemptions to these things, and that would be in the program guidance. For example, free clinics is something that they may be exempt from charging, obviously. So just make sure you're reading that guidance and getting that if you meet those exemptions. And then the certification that you provide comprehensive primary care. And again, this is varies kind of within the approved disciplines and specialties, which is detailed in the program guidance. And just behavioral and mental health clinics specifically, there's some sort of, there's specific services that you should be providing in order to meet that definition. Okay. So once you have checked through all of those, then you can hit the next button here. This is the Contacts tab. So this contact should be the site administrator. You can edit or add another contact if you need to. We have heard from past application cycles that this functionality is a little temperamental. So if you're having problems with it and it's not allowing you to edit, just contact us and we can kind of help you through that. We know that there's some glitchiness to this, so just be patient with us and we'll figure out a way for you to update that information if you need to. And then you can go on to the Facility tab. So this is information regarding the facility type, and then this is also where we are collecting the patient data. So the facility type you would select from this drop-down menu, and I will say for those of you that are familiar with our past site applications, we no longer are requiring that you complete your site application by discipline. It's just by physical location now. So if you do have a clinic that has multiple disciplines within the same physical location, go ahead and click the clinic with multiple disciplines there. And then you're able to enter in all that information based off of the physical location, not broken out by discipline. And then facility designation, this will be the drop down of options for you to choose. So pick one that best describes your site and your designation. And the patient profile data. So column A is the underserved patient count, which we have a description, the total annual unduplicated active Medicare, Medicaid, CHIP, uninsured charity patients, sliding fee schedule patients. And then column B is the total all patient count, so the total annual unduplicated active patients. And this information will help us get the ratio of underserved patients that you are seeing at this site. And I will note that the medical or hospital and nursing home, if you select those as your facility type, the patient data is actually reported as patient days, and this information will change, so you will be putting in that information. So this is the license type. So this is where you're going to be requesting your provider license types. Let's see, we have a question. Okay, so for clinics with multiple disciplines, do we combine data, for example, the dental and behavioral health departments combined. And yes, so if that physical clinic has those serves those patients, you're reporting all patients for that physical location. Okay, so we got to the license type tab. So this is where you're going to put in your requests. This information represents the staffing shortage need at your site. So you're selecting all the provider types that you represents the shortage needs at your site. And it's important to make sure you're including all relevant, provider types, because if the license type is not requested on this site, then that would prevent the provider from being able to apply in January. So I would just make sure that you're really knowing the needs at that site and who is you're wanting to request to be eligible to apply for the loan repayment in January. So, and also if you're selecting a license type that works at multiple sites, make sure that's reflected. So I know that's been a problem in the past. If there is someone that the FTE is split up and covering and actually working at 2 separate physical locations, make sure that that is represented in your site app. So it would be 0.5 here, 0.5 under the other site application. And then this is a new this year. This date used to be July 1st, and we have changed it to October 1st. It's a little bit closer to when you are filling out this information. So we will be getting your staffing data as of October 1st. We'll want the budgeted FTEs, the filled FTEs, the vacant FTEs, and then retention requests. So retention requests are providers that are already on staff that you're wishing to retain through loan repayment. And also new this year, we aren't going to prevent providers from applying in January if they are considered a vacancy fill or a retention request. It'll be they will be able to apply based off of just your provider license type request, but there will be some priority assigned based on the shortage data that's collected above. I think we have a question here. That one right there. Is there a reason you require specific numbers for retention rather than leaving it open-ended to allow more potential participation? So there is a reason we ask for that retention data, because it's a measurement of how many providers that you have on staff that you are hoping to retain through this program. So it goes into the calculation to figure out a measurement of your staffing needs at that site. It's not going to prevent someone from applying. That's kind of what I was explaining with the recruitment retention. So before, based on the hire date, a provider had to kind of fit under a certain category of either under a vacancy request reflected or a retention request reflected, and that's no longer the case. They'll still be able to apply. We just have, this is our way to measure that priority. How do we know for retention requests which staff are eligible? Well, we have in our program guides, obviously you won't know very specific information about the provider if they are eligible for federal or state for some other factor that you're unaware about in their personal life. But as far as providers that have expressed interest to you about the program, who are looking that you're wanting to retain, and that they meet the hours requirement. So in the federal and the state guidance, there's some specific hour requirements that you can review to make sure if that reflects, someone that you would be requesting loan repayment for. So they have to have a certain amount of hours of patient care. So those are some of the things you probably would be factoring in as far as your request. Okay, go on to citing fees. So this is a specific requirement for the federal program, and you have to meet this criteria specifically. So if we don't already have this documentation or from past applications, or we don't have this information on file, we may be requesting some supporting documentation for this. There's some examples of the citing fee schedule in the guidance as well, and you have to be eligible for all of this criteria to qualify for the federal program. So we have options down here. The site has a citing fee schedule, does not have a citing fee schedule because it meets the exemption, which would be some of the state facilities, and then it does not use the citing fee schedule. So if you have any questions about your discounted policies that you have, or you're not quite sure if it's meeting the definition, just reach out to us so that we can kind of help you walk through that to make sure that you are kind of meeting these this criteria. Okay. And now we're on to the review slide, and you're going to make sure that all of your entries are accurate, that you kind of went through. And again, just a reminder to not use your back browser button. If you need to navigate through the application, you should be able to from these tabs up here or the previous button here. And so you certify that this information is true and accurate and complete, and then you would submit your application. And then this is what the screen would look like once you submit. It will list your site name, the date that you submitted, and then it'll say pending review by staff. And this status actually never changes. It doesn't update even if we were to review it. So unfortunately, it's not a super useful status. But you can note that it has been submitted, and then you can view and print a summary of your application of the information that you had entered. And then if you're going to add another site, you would click this Add Another Application button, and that will pull you up to another blank application for you to kind of complete the process all over again. That concludes the site application. So if there's any questions we can go over. Okay. If we are hoping to retain all providers and give them the opportunity to apply, we can simply provide a total number of eligible providers at that site. They should be, correct me if I'm wrong, Chris, some people that have expressed an interest and that you are wishing to retain. It is kind of up to your interpretation on that, but it is to people that are interested in applying or have expressed that you would want to retain them through loan repayment. For some people, it's just not, some staff, maybe there wouldn't be an eligible provider type, or their hour requirements just don't work within the program. They don't have eligible debt, which is not something that you necessarily would know, but it's really supposed to reflect the providers that have identified wanting to access this loan repayment program. Is the limit for 2018 still 2 professionals in each field at each site? I heard that might change the limit for 2018. That is still our cap. If funds remain available, that may change, but it was divided out into specific recruitment retention caps, which we don't really have that specific identifier for providers. So it would just be 2 provider types per site. So when we post counselor positions, we are open to hiring licensed mental health counselors, licensed independent clinical social workers, or licensed mental or marriage family therapists. Would we have to enter those separately, even though we only have 1 in the budget? Great question. So this year we've actually made that a little bit easier, and we have made that license type be grouped. So similar to and Vicki, you might know this because I think you have filled this out in the past, to the APC request. So the APC has the nurse practitioners and physician's assistants grouped together because those are interchangeable. So we did the similar grouping with those behavioral health license types this year. If it's for our programs, they don't apply for extensions. So the continuation contracts are based on funding. It's not something that you would apply for. The providers aren't submitting an application for that. So any type of continuation award is done outside of an application cycle, and providers would be contacted for their eligibility once their contract is ending. And the guides, I'd like to remind everybody that the guides are linked at every tab throughout the application. So you don't have to worry about going back to try to find the links, that they are conveniently linked up here for you. At what point will we have to provide the individual provider's data? So that would come during the provider application. That's one of the questions that we had on the employment site verification form that gets completed by the site administrator, and that's downloaded from the provider application, and it's kind of the provider's responsibility to get that form completed and submitted during that application cycle. And I know there's some questions about getting a copy of the slideshow, and we will email that out to everyone, and we're also hoping to post this on our website too, for people to refer to that were unable to attend. Is there a maximum number of applications that can be submitted by an organization? I do not think so. I think, yeah, it's as many physical sites as you have, you should be, applying for those if you wish. Could you go over the difference one more time versus about the budgeted, filled, and vacant? Yes. Let's go back to that screen here. Okay, so the columns here, A, B, C, and D, and then there's the descriptions of them down here below. So for each provider license that you're selecting, you'll be putting in your budgeted FTE for that license type at that site, the filled, how many positions that you have filled as of that October 1st date, and then how many vacancies. So the vacant and the filled, so column B and C, should add up to your budgeted. And then D is the retention requests that we had went over of the providers that are already on staff that you're wishing to retain. Do we have to submit a list of names for providers that are interested in applying for a retention spot? Last year we had to submit photos and as well as a list of interested providers. That is not a requirement that we are doing this application cycle. We have language that allows us to kind of request additional documentation if we need to verify anything, but that is not something that we're planning on collecting this year. Is there an estimated total amount of funds that are available for awards this year? That is, we don't really have that finalized number yet. We will be publishing once we have that. There is funds, we just don't have the exact dollar amount that we will be using for new awards. You may have answered this at the beginning. Last year we had to separate out our specialties and create separate applications within one clinic. So we had 4 applications for one clinic. We now only need 1 application per site. Yeah, so we did try to do some cleanup on our end as far as if we had those multiple sites that were listed out by discipline, we tried to just have 1 application for physical location. So that's it's important when you're filling out, especially those who have previous applications in the system. to make sure you're selecting the right the site name. So if you see any issues with your site name, but it's not the right address, let us know. But we try to do that cleanup for you so that you wouldn't have to go through and figure out your medical, dental, pharmacy ones that were broken out last year. So trying to make it a little bit easier on you and only having to do one physical location. Is there a system we can utilize to log in and see which of our providers are participating in the program and utilize that system to complete quarterly service verifications? That is something that I would love. We all would really, really love that. And I think it's definitely on the horizon of something that we want to do. We are continuously trying to update our application. This was kind of we had to use our old application and kind of try to make these upgrades to make it go a little bit smoother, but we are anticipating some newer technology as far as the application system and hopefully eventually some portal access for site administrators as well. So yeah, great question. Currently the answer unfortunately is no, but that's something that we would like to do in the future. Where can I find what behavioral health license types have been grouped? So good question. I'm trying to see. I don't think I'll be able to show you guys here. It is the master's level licensed mental health counselor, licensed independent clinical social worker in, let's see, and the family marriage therapist. So those are the ones that are grouped. The clinical psychologist is not grouped into that. So those are the provider types that would be listed as the behavioral health. And it actually shows you, when you select this here, it will show you in parentheses what license types are included in there. So it will be evident once you're selecting it for your site application. I think that was already been answered. What happens if our FTE needs for a provider changes mid-year? Do we list the budgeted FTE as it currently is or expected need? I would say as it currently is. This is it's kind of a snapshot of your need. We recognize that there's no way to really predict what is going to change in the future. But we've tried to kind of accommodate that so that if you're selecting a provider license type, it's not going to prevent someone to apply based on your vacancy or retention requests. So the need for that provider license type is identified and providers are able to apply with that license type. But as far as kind of the snapshot measurement of your staffing need it should be as of October 1st. What percentage of applicants sorry, I lost that question. I think it was what percentage of applicants received funding. And unfortunately, I don't have that, the number, and I don't want to take a stab in the dark. So that's something that I could follow up with you on once we kind of review that. So due to turnover in our department, those of us here currently have not been involved in the application process in the past. Is there a way to know what sites have had applications submitted for previous of our organization? Yeah, great question. So you can, what would be the easiest? Okay, so contact Chris, just our general program staff. The mailbox or our phone line, and we can look that up for you and let you know what sites are listed in there and make sure we get all the sites added into the system that we would need to. Is there a 40% minimum threshold to qualify for the program? Is that number unique? Is that the number of unique patients that is requested in the application, or does that have something to do with claims? So there's a 40% minimum threshold for underserved patients for private practices specifically, but it is the intent of the program and the goal of the program to be serving underserved populations. So it is definitely a factor in your site eligibility. think we have answered them all. If we've missed anything, we'll kind of review the chat log too, and then I will send out a copy of this to everyone who's participated, and then we're going to work on getting some of these screenshots on our website too, so that they'll be available for you. And the site application is now open. We encourage you to apply early, ask questions, contact us. We're here to help you through that process. And it closes December 8th. All right, thank you.